Bismillahirrahmanirrahim. Welcome to Pharma Concepts. In today's video, we will discuss the medication errors and how we can reduce such errors. Medication errors are mistakes that occur during the prescribing, dispensing, or administration of a drug. The very simple definition of the medication error is the failure in the treatment process that led to and has the potential to lead to harm to the patient. The medication errors occur due to incorrect prescription or order, due to the wrong medication or dose, due to incorrect administration route or timing, due to the failure to monitor or adjust the treatment. And such type of errors can occur at various stages while during prescribing, during transcribing, dispensing, administration, and while during monitoring of the medicine. The figure shows that most of the medication errors has the potential to lead to the adverse drug effects, which could be preventable and not preventable. Like one third to one half of the adverse drug effects are related with the medication errors. Medication errors are classified according to the different approaches. So based on the psychological approach, the medication errors are divided into mistakes, slips, or lapses. Mistakes are the errors that occur during the planning of an action. It could be knowledge-based or rule-based. The knowledge-based errors are like giving a medication without checking that whether that patient is allergic to that medicine or not. For example, prescribing penicillin without establishing whether the patient is allergic or not. So such type of mistakes fall under the knowledge-based mistakes. Then we have rule-based errors. This is the misapplication of a good rule. For example, injection diclofenac. Uh, injection diclofenac, which should be injected at the lateral thigh rather than the buttock, as it can lead to sciatic nerve damage. Also, the misapplication of a bad rule or a failure to apply a good rule also led to the rule-based errors. For example, excess dose of a drug can cause increase in the side effects or some life-threatening effects like cardiac arrest, anaphylaxis, or organ damage. Then we have slips and lapses, which are the errors that occur during the performance of an action. A slip is a mistake that occurs during the performance. For example, writing the very familiar names like chloropropamide instead of chlorpromazine, and picking up a bottle. We are supposed to pick up the diltiazem, but we're picking up diazepam. So such type of mistakes can lead to medication errors. And such mistakes occur due to distractions, due to weak muscle memory, or due to mental fatigue. Then we have lapses, which occurs. Lapses are the mistakes that occur due to injurious memory, like giving a drug to the patient that we know that he is allergic to that medicine. And if we talk about the technical errors that result due to the failure of a particular skill, for example, insertion of the cannula. If the cannula is inserted wrong, it can lead to the nerve damage or inflammation or bleeding. Such mistakes occurs due to the memory failure, due to lack of attention, or due to the mental overload. Medication errors are further classified according to where they are occurring in the medication use cycle. They are divided into prescribing errors, dispensing errors, or administration errors. Prescribing errors are the errors that occur during the prescription, like the incorrect drug selection for a patient. These errors include wrong dose, wrong quantity, wrong indication, and prescribing of contraindicated drug. The factors that contribute to such errors are illegal handwriting, inaccurate medication history taken, confusion with the drug name, inappropriate use of the decimal point, which is not very prominent, use of the abbreviations like AZD, which can cause confusion between iravudine and azathioprine, and use of the verbal orders. The figure shows a prescription which has a poor handwriting and is very difficult to read. Such type of prescriptions can lead to the prescription errors. Approaches to reduce the prescription errors include we can use electronic prescribing. And we can also use systems like computerized physician order entry system, which can reduce such type of errors. Then we have dispensing errors. These are the errors that occur during the dispensing process, from the receipt of the prescription in the pharmacy to the supply of a dispensing medicine to the patient. It occurs. It occurs. It occurs with the drugs that have very similar name or appearance, which are look-alike and sound alike drugs. For example, we have Lasix, um, which has an active ingredient furosemide, and we have Losec, which has an active ingredient omeprazole. They look very similar when handwritten. Similarly, we have a picture here showing us the similarly we have a picture here showing us the bottles. One is ampicillin and another is amoxicillin, which is very similar in appearance. And such type of medicines can lead to dispensing errors. So approaches how we can reduce such type of errors is by ensuring a safe dispensing procedure, by separating the drugs with a similar name or appearance, and also by spreading the awareness of high risk drugs like potassium chloride and cytotoxic drugs. At last, we have the administration errors. These errors that occur during the administration of the medicine to the patient, and such type of errors occur widely in the nursing area. So while administering the drug, we should focus on the five rights, like giving the right dose of the right drug to the right patient at the right time by the right route. The approaches to reduce the administration errors is by checking the patient identity, by ensuring the dosage calculation, which should be checked independently by other healthcare workers too, and ensuring that the prescription, the drug, and the patient are in the same place. And while before administering the drug, we should check against the drug and we should check again the prescription, the drug, and the patient, and also ensure that the medication is given at the right time. And also by minimizing the interruptions during the ward round, we can reduce the administration errors. These are some of the key points that we should keep in mind so that we can reduce the medication errors. Medication errors are one of the most preventable causes of patient injury, and the majority of the medication errors occur due to the poor prescribing. And we can improve it, we can minimize the errors by improving the prescribing skills. The problems and the methods to avoid the medication errors are very multifactorial. We can use non-punitive approach to reduce the errors. Non-punitive approach is by focusing on the system rather than blaming the individuals. Such type of approaches can encourage the reporting, learning, and also helps in the improvement of the and also help in the improvement of the mistakes. That is all about medication errors. Keep um, keep up with us by subscribing my channel for more related videos. Thank you.